Program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson, and it's my pleasure to have with us as our guest tonight, Dr. Steve Wilson. Welcome, Steve.
Thank you.
Nice to have you. Nice to have you with us tonight. And there are a lot of things that we could talk about in your journey through life, but I think tonight one of the things we wanted to chat with you about is your mission work. And you were telling me earlier you'd been on 14 mission trips. Is that correct?
They've all been to Central America. We've done quite a number of trips since started taking them in 2000, and we've been to many different countries.
Now, how did you get interested in this, Steve? Is there some reason that you felt compelled to do this, and how did
I'll
that
have to
happen?
go back a little further. Years ago, when I was in medical school, at the University of Louisville, we had a little clinic called the Greater Louisville Organization for Health, and we went out to that clinic, which was in the middle of the projects in Louisville, Kentucky, to help try and make some difference for the people out there. We saw an awful lot of different things out there, and that was as a student. Then as an intern and a resident, we had several members of my residency program who had been missionaries in different places, including Dr. David Stevens, who's the current executive director of the Christian Medical Dental Association, and he spent many years in Kenya. And he came back and would show us all of his slides, and we had several other members who did that. After I got out into practice, I had the opportunity to do a lot of mission work inside the state of Georgia at various places with the Georgia Baptist Convention and their organization called the Baptist Mobile Health Ministry, which was actually partly founded by my wife.
Is that right?
Yes.
Oh, okay.
And they developed a mobile medical unit that would go all across the state. And we used to have health fairs here at the Spanish Baptist Mission out on Fagan Mill Road for many years when they would come to town, and then we would go to various other places around the state. And I've literally been from one end of the state to the other doing these mission work. Overseas missions didn't start until 2000, and that was actually as a response from the Georgia Baptist Convention to send people to Guatemala in the aftermath of Hurricane Mitch that had gone through there the year before, and it caused massive destruction through there. And it was mostly disaster relief type of work. When we got down there, we found out they had a few things they wanted us to do a little differently, but that was still nevertheless one of the things that got us started. And I've been going back sometimes a couple of times a year since then.
Wow, well that's really an extraordinarily good thing to do, I think. As you made your trips, I mean, do you have what is it that strikes you about I guess the medical conditions in Central America? Is there any comments, the social structure there? There's just a lot of human misery in that part of the world.
There is a tremendous amount of poverty down there. And in practically every country I've gone to, you've always seen the very wealthy people, and then there's usually an educated middle class, but even that's maybe a total of 20% of the country. And then the remaining 80% of those countries are poor, and they range from the working poor up down to the people who have absolutely nothing, live in little squatter villages up on the side of a volcano or something. And the latter group is primarily who we go to serve. Medical care is difficult to get in some places. Some places almost non-existent. I cannot tell you the number of times we've been there and have people come in and say, how long have you seen the doctor? I haven't seen a doctor in 20, 25 years, and so things have just get ignored. And part of what we're trying to do is to not only provide that humanitarian care, but we are also trying to carry the gospel message of Jesus Christ to those people. So we always work with our local pastors, with local churches. Being a Baptist, we work with evangelical and or Baptist churches in those areas. And hopefully that way we can have some lasting impact on those people's lives.
Well, that's a good story. I like that story. I mean, this is sort of goes along, I think, with the healing. I don't know, if you're a physician, you'd like to think that you're sort of a missionary in a way. You're trying to heal people, and you'd like to take away pain and suffering. That's what we'd like to do, I think. And certainly there's a lot of that in those areas. And you've gone back and forth a number of times, and your facility with Spanish, I think, is a good skill there. Is that right?
Yes.
You were telling me a rather interesting story. Maybe you'd like to say hello to your wife now on television about.
Hi, honey. My wife is Cuban, and I learned Spanish when I, of course, was in middle school, high school
Yes.
time frame. Never really used it much.
Yes.
But then I met my wife when I was a second-year resident.
Yes.
We got married, and of course, a lot of her family still are primarily Spanish
Yes,
speakers.
yes.
So it turned out to be a useful
Yes,
thing to be
yes,
able to
yes.
communicate with my wife's family.
Yes.
And but as I've gone on these trips, and as I've seen more and more Spanish-speaking patients
Yes.
in my practice, it has turned out to be a very useful skill, and I've kept it up. So it's been something I think turned out to be very beneficial.
Yes, yes, and communicating with people in different countries. I mean, if you're there, going through an interpreter is just such an encumbrance, is it not? Trying to
It is.
really get to know the people and.
Sometimes they're very surprised when they hear me speaking
Yes,
Spanish back to
yes,
them, and I'm
yes,
asking them questions,
yes.
and they're actually shocked that somebody actually knows their
Yes.
language.
And what countries have you've made these mission trips? What countries have you been to? It's a
Well, the
big-
primary ones have been Guatemala, Honduras, El Salvador, and Nicaragua have been the four main countries that I've gone to.
Yes, and so all of those countries have had all extraordinary domestic tensions, civil war, upheavals, extraordinary poverty, and lots of people have been, for economic reasons, have made their way, in many cases illegally, across the border. I mean, it's just to stay alive. It's
Well,
very-
I mean, after I have been to some of the places that some of those people
Yes,
have lived in,
yes.
I can understand why they have such an intense desire to get out of there,
Yes.
because they have nothing, and in many cases, because of political structures, economic structures, ethnic background, maybe they're from an Indian tribe
Yes.
or something of this nature, they don't want to stay there, and they feel like they have a better chance of moving if they come to the States. So I think there's a lot of things that drive those people. We've actually gotten to know some people over the
Yes.
years, some of whom have come here legally
Yes.
and have actually become friends.
Sure.
And some of whom have come here legally and have stayed.
Yes.
Others who have come here legally and go back and forth.
Right,
They may
right.
have their family in, say, Honduras or Guatemala
right.
and go back and forth. We always enjoy meeting with and talking to those people.
Yes.
But a lot of them are still very desperately
Yes,
poor down
and many times the paycheck they receive here supports the whole family, the whole village depends on that money coming back.
there. Many times, yes.
With the economic downturn, has there been any kind of, I guess, that flow of revenue to Central America? Any comments about that? In the U.S., is it making it a little harder there? Is there repercussions?
Well, I haven't really got into that when I'm
Yes.
talking to the people, but the general economic downturn, certainly you see things like tourism and other sorts of things are
Right,
down
right.
in a lot of those countries. And there are some parts of those countries that depend very heavily on tourist dollars.
Right. Now, Steve, I think you have some pictures. Are you going to
I
show us
do.
something? We can
This is
maybe
from,
look.
these pictures we have are from our latest trip, which was in July. You can see the date, July 14th there, to the town of Tela, which is in Honduras. It's on the coast of Honduras, Caribbean coast. And this happens to be our surgical team. When we first started going, it was just generally primary care teams, but as we got in there, we discovered that there was an awful lot of unmet surgical needs,
Yes.
general hernias,
Right.
thyroid problems, ear problems, and so on. If you go back to that slide, I'll point out a couple people real quick. In the back, you see Dr. Ken Walker. He's second from the left. My wife is in the orange scrubs there. The guy holding the package is Dr. Horatio Cabaceras, general surgeon from Perry, and behind him,
Aha.
is,
Yeah, I know him. Yeah, he's a good
behind
guy.
him in the
Good
red
man.
shirt is Dr. Kevin Woods, anesthesia. He is from, of course, here in Warner Robins.
Yes.
And then the ladies on each end, that's Ms. Frances Josie and Amanda Delfer, were two of our nurses, and the lady in the green scrubs is Dr. Walker's daughter, Erin, who went to help him out and scrub with him. The lady in the white in the middle was the head nurse, if I remember correctly, of the operating area in the Tela Hospital. So,
Well, let's just go through your slides here. Let's see
all
what
right.
we have.
This is Dr. Walker. There on the left. That's Ms. Delf there on the right, scrubbing in with him, working on it. Believe that is a thyroid case. And the other doctor looking in is one of the local anesthesiologists that we had the opportunity
Now,
to
was
work
the
with.
equipment adequate there to do these kind of procedures?
I did not actually physically get inside this hospital or this operating room because
Yes.
I was in my own clinic, which
Right,
was a
yes.
few miles down the road. But from what I understand, the equipment they had, this particular hospital is only 5 years old, so it's a fairly
Yes.
up-to-date hospital, but they have less equipment, but the equipment was considered to be adequate. There were certain things that we did need to bring with us, which we did. For example, Dr. Walker's headgear, they certainly didn't have anything like that, but he was certainly able to function with that.
Now, sometimes when you take different kinds of medical equipment or I guess, things to help people in the country, there could be difficulties. You were telling me the story about sometimes they might confiscate things that you were.
If you're not careful, you do sometimes see that they might want to take them from you. Now, some of the stuff we took with us was intended to be kept down there and left
Yes,
down there
yes.
As gifts for the people. And but we stayed busy. I know they did 38 surgeries in 4 days.
Wow, they were really busy guys there.
Very busy.
Well, let's see. You have some more slides. Let's see. Do you not?
That's my wife in the operating room with one of our patients. I'm not certain exactly what she had done. I think, if I remember correctly, she actually had a gallbladder taken out by Dr. Cabacera. So
Wow.
we even had simple cases like that. He did a lot of hernia surgeries down there.
Well, he's a good man. He's
He
a good
is.
man. He certainly is.
Okay, next. We also took a construction crew with us. Last 2 or 3 times we've had some construction folks. These are all men from my church. We've got quite a number that like to go. And this is the first one was of a church that they were re-roofing. This is a pastor's house that they're re-roofing. You see a couple of our young guys. We took about 7 or 8 young men from our church, all of whom were high school, college age. And
Well, that's great. And let's
helping.
give your church's name on the air. Let's talk about
my
that.
church is Central Baptist Church here in Warner Robins. They have always been, this is a very mission-minded church,
Yes.
and they have supported us since we started doing these missions. And I've had numerous people that have gone on these missions. I've had a couple of our ministers who've actually gone
Yes,
with us on
yes.
these trips. I know some of our other ministers, like our head minister, he likes
Yes.
to go to places like Moldova and Eastern
Oh,
Europe.
wow, yeah.
And
Wow.
so we've got a lot of people that really like to go on them. We had 38 on this trip with us, and there were 34 from here. And then we had 4 people join us from the Boston area, a pediatrician friend
Yes.
of mine. And we had, I was trying to think, we had 27 last October, and most of them were from our church. But many of them were different people. So we've had 200 or 300 different people go on these mission trips from our church over the last 12 years now.
Wow, that's great. That's great. Well, let's see. Do you have more slides here?
I got a couple
Well,
more.
Let's just
we
go through your
always take a
slides.
pharmacy with us. The group we work with down there is called the Rice Foundation, and they have their own storehouse in the city of Copan, and we have helped stock them. But about half of those we took with us. We'd take these big containers and
Yes,
bins
yes.
and travel and duffel bags and whatnot, and then put them on these racks. And this happens to be a school that we were working at, and this was actually one of the nicer places we've worked at in a while for the pharmacy people, and they just laid it all out. And they did all that in an afternoon, getting all that all laid out. And then, of course, they took it all down in an afternoon after we'd finished with our clinics. Next. The beautiful open air waiting area for
Yes.
the patients. As you can see, they're just lined up out there waiting to be seen. This actually is outside the dentist's office to the right. That we had a local dentist working with us, and my room was down there on the right, and the pediatricians and the nurses were down there on the right also. And these people just line up and they'll wait all day for you.
How did the people learn of your presence there? Was that through the churches? Or
The local churches, most of the time, they will tell their members. They'll put out flyers. They'll do other things. We found out this particular case, they even took out some TV time and put
really?
on local
Oh,
TV
wow. Wow.
stations.
So you
and
had no
radio
shortage
stations.
of,
We had no shortage of patients, and we had people coming in for all sorts of things, many of whom we were able to help. I regret there's times we just can't help everybody.
Yes.
And some people came to us looking for things like hearing aids, for example. We
Really?
had several people wanted hearing aids. We just didn't have any of
Yes,
those. So.
yes.
And of course, we do general medical care and examinations. There's a lady I'm examining there. See, we just work inside the school there and pull them up. The other lady in there is just one of the local helpers.
Yes. Any comments just about the general health of the population? I mean, in the U.S., we worry about obesity and hypertension, and people are overeat. I mean, was there a similar set of problems? Or
We see some of that. I think, honestly, I've seen more of that in the last 5 to 8 years than I used to. When we first started off, I rarely saw somebody who was obese, but you would see a few.
Yes.
And we didn't see much hypertension and diabetes because, to be honest with you, in some of the people we saw on our first trips, the life expectancy was maybe 55, 57 years.
Wow.
The people in Honduras that we went to this time, slightly better off. There was a little bit more industry where we were. We saw a good bit more older people this time, and
Yes.
yes, I saw more hypertension and diabetes. It's not the majority of things, but we do take some medicines
Yes,
for that.
yes.
But these people still suffered from things like worms and
parasites,
intestinal problems. They had the same problems we did, colds and flus and other sorts of things. The young man, that's Dr. Emily Swilling from Boston, Massachusetts, a friend of mine, and she was, of course, examining that young man's belly. I think it's more tickling him than anything else.
He looks like he's enjoying that.
He's enjoying that. So, but we try and provide as much care as we possibly can with the limited resources that we do have.
Now, there's an enormous, the demographics are in that kind of country, a developing country, there's an enormous number of children. And,
yes, enormous.
Yeah, and that's a big problem, isn't it? Just huge numbers of children.
We see loads of children with all the usual childhood diseases, ear infections, throat infections, the same sort of stuff you see here, but you have to add in the malnutrition, you have to add in all the other sorts of things, many of which get ignored. We, of course, take a full-fledged nursing staff. This is Ricky Powell. He's actually the son of the chief financial officer of Houston Medical Center.
Well, there you go. That's a little pump there.
Well, I'll give a pump to Houston Medical Center right now because they have generously given to us every year.
Well, let's do that. Let's do that. That's extremely nice. You want to mention some names?
I'll mention Frank Powell, who is the
I think they deserve some credit here.
Mr. Frank Powell, who's the chief financial officer of Houston Medical Center, actually took his whole family this time with us. None of them have ever been on a mission trip. Ricky's an EMT, and so he was working with the nurses. I don't have a picture of Frank, but he was primarily doing a lot of work out with the kids. His wife was one of our people on the his wife and daughter both were on the children's ministry with us, and they have supported us. The previous administrator, Mr. Skip Phillips, who's now in Virginia, I believe, he went with me twice.
Oh, really?
A very, very good man. You can see what we do is we do the basic stuff with them. We take their temperature, we weigh them, we do their blood pressure. We do take little machines. I must admit they're very nice little machines to check hemoglobin and blood sugar and all sorts of things. So we can do some work to help a lot of patients out.
That little buckaroo seems pretty pleased.
He was pretty pleased. You'll notice he's got a pair of flip-flops on his feet, and those were donated. We took several hundred pair of flip-flops primarily for the kids. And that helps with a disease called hookworm because hookworm is transmitted through the soil. Contaminated soil gets into them, and then, of course, that leads to malnutrition if they get the internal parasites.
And are those diseases are endemic? Are they not?
They're endemic down there, yes. And if you just have some basic foot covering, you can kill off a lot of that.
And how about things like hepatitis? And I mean, there are a lot of chronic hepatitis.
Yes, we see that.
Different kinds of hepatitis. Yes.
We had a chance to go to the prison in Taylor.
Wow.
And I don't have any pictures of that because we weren't allowed to take pictures inside the prison. But what we got in there, of course, you get the typical sort of prison things. You saw the people who were the substance abusers, who had been in gang wars. You saw, well, I hate to say it, some of the folks who were had mental problems, who had committed crimes and things like that, and they were dumped in prison down there. And so we did see those sorts of things too. And we had a couple of cases of people who had known TB and known hepatitis there in the prison, so we had to wear masks and be very protective about that.
Well, that's quite an adventure you've been on, and I've done that not quite in the same way you've done it, but in the past. And we were remarking earlier, I'd been in Honduras with my wife, back in the late '70s. I shouldn't say I'm that old, but it's the country is going through enormous changes, is it not? And lots of things happening, and still still a lot of many problems in regards to health and maybe societal breakdown. Is there a problem? I mean, people are poor. There's a lot of corruption in different locations, and
it varies from country to country about how bad it is and where it is. But we see. As I was marking earlier to you, you see a rich group of people who own about 10% of the country. They're about 10% of the country, and they own about 80% of the country. And then you have the middle class that's about 10%. Most of that's your doctors, your lawyers, your accountants, and so on. And then the rest of the 80% is just poor. And that hasn't changed in a very long period of time. And I don't know if it's actually going to change. You see very large families along a lot of the poor people, especially if they work out in the rural areas because they need the field hands, to be honest with you. So.
And the population growth is so extraordinary. It's extraordinary, isn't it? I mean, isn't that one of the issues about, I guess, developing countries or how to make things work is if you're getting 10 kids, if every family has 10 children, it's very difficult to, from the point of view of society, to integrate those people into a very weak economy, and
you have to feed them.
Yes.
And infant mortality in some of those countries is 10, 15, 20%. So if you have 8 or 10 kids, you're going to lose a couple for them. Speaking of schools and kids, this is Mr. Scott Custer, who has been with me on a multitude of trips, and behind him is Miss Jan Floyd, who was our children's ministry chair this time, and they are in a Honduran school where they're ministering to the kids. We find it very different, and this is the thing I think they find. Jan is a school teacher here in Houston County, and as she puts it very plainly, you can't mention Jesus Christ and then put a Bible on your desk and do those things inside our school. Down
Yes.
there, they openly invite you in
Really?
to do these sorts
Wow.
of things.
Wow.
And so it's a big difference in the
So
culture.
is that, I mean, it's many ways it's a Catholic country, but no one has any objection to
We didn't have
Southern
any-
Baptists being there, and no problems at all.
No
right?
problems with
Yes,
that sort
yes.
of thing at all. So, in fact, that last slide.
Let's
think
look at the last slide,
Of the
yeah.
ladies there. This was. These are all the pastors' wives.
Oh, really?
And they were the ones primarily responsible for doing our evangelistic work. Every patient that comes to us, being a religious organization, they sign in, and then the first place they go is to these ladies who will talk to them about where they are. Are they a Christian? Are they
Right,
not? If
right,
not,
yes,
then they
yes.
talk to them about Jesus
Yes.
and about the gospel message.
Yes.
So,
Do
and
do
then-
the
then
children
after
get
that-
a chance for education there? I mean,
Yes.
yeah. So
Yes.
people really have an exposure, at least to.
Some, yes. For example, this is Frank Powell's daughter Carly, and she's on the floor there with the little girls. You can see they're all there in their school uniforms.
Yes.
And the schools down there, you either have private schools like this school, or you have the public schools, which are usually much poorer off. And we find there are some differences there, but the kids are wanting to learn, and they love to see us
Yes.
come.
Yes.
So.
That seems like a nice group of young people there, and,
And there's Miss Floyd again. And the kids, they don't want you to leave.
really.
No, they really don't. So.
Wow, it's a happy scene. It's a happy
It
scene.
is. So, and I believe that's back to
We're
the
back.
end, so.
Well, that's a nice. Those are nice pictures. I mean, that's a nice thing there. Well, now does the Central Baptist Church organize these trips episodically, and people that have an interest in doing that, they certainly
Yes, we do.
can
And,
find a way to get involved.
Obviously, if you are a member of Central, you'll hear about it. If you want to know more about it, you can either contact me, because I'm the chair of missions council over there this year,
Yes.
and so I can get you the information about these trips, but also you can go to our website, and there's always mission opportunities. Our next mission trip to Honduras is to the Copan region,
Yes.
which is up in the northwest portion of
Yes.
the country, and that's in October of next year. And we'll be going back to the Tela area where we were this time in July of 2013. So we were already scheduling our trips a
Yes.
couple of years out.
Yes, I've been to Copan in my younger days, when the late '70s, shall I say, as I was there with CARE and doing some things, but quite a place. And the Mayan ruins are just extraordinary there.
They
I mean,
are. That's an impressive sight.
And there's this sort of this ancient culture that's right in the middle of the jungle. I mean, this extraordinary, quite a place, isn't
You
it?
just basically drop out of the mountains right down into the valley, and there is these incredible ruins, and you realize these were people who put these together. They didn't have donkeys and horses and oxen, and this was done all by human labor.
Yes.
And the stonework is incredible that they have there. So what they were able to do back, 1,200-1,300 years ago. And the Mayan people are still around.
Yes.
Obviously, that civilization collapsed, but the Mayan people are still around, and we still see many of them, and many of them have mixed their way into societies and down there.
Yes.
In many ways. So.
Is it a little bit difficult, I mean, to be an indigenous person there? I mean, the way the culture works, if you're a country person and you're of Indian descent, it's sort of a little hard for you.
To be very honest with you, you're actively discriminated against if you're of those tribes. And there are varying tribes in various places. In fact, it was even legal up until, say, just a few years ago that people of Indian descent couldn't make public office. They couldn't do other sorts of things. And but a lot of that is changing in the last 30 years. Some of those civil wars that they had back down through the 70s and 80s, a lot of that was rooted in that. Some of it was rooted because they wanted land holdings. And so things have changed a little bit down there, but there's still an awful lot of people that still feel like the Indians are still, how should I put this, of a inferior group of people.
Yes.
And they still try and keep them down. And you see it in many places and in many ways. So it's a difficult thing to really see that. But you have to understand that is part of their culture, and that goes back in some cases hundreds of years.
Yes, it's each of these countries have their own story that's complicated, and I think each nation, as it tries to make its way towards some kind of, a better world, they have to encounter their own history. Well, the Southern Baptists are there and going in trying to help things. You have any suggestions about, just from your experiences there? What is it the countries need? What could we do here? We're just
Well,
Any comments about that?
the main things I could see that we could do to help these people out is, number one, obviously pray for them. I mean, we always are, Baptists are
That's
very
not a
big on
bad thing
that.
to do for anyone, is
We're
it?
big on
No,
prayer.
no, good prayers are good for anyone, yes.
But I think the thing we have to understand is if we're going to go to these countries and we're going to set up long-term relationships with organizations like the Race Foundation that actually works down there and is going to put themselves in a position where they're going to be there for a decade or 2 decades,
Yes.
as opposed to just go in, hit them for a week and leave, is that you want to get to know the people and understand them as best you can. So you need to do your research. You need to go down there and not just spend your time at the tourist spots, but get out into the bush and get
Yes.
out into to understand what the people are like and what they're doing. You'll find them to be very friendly, open,
Yes.
and once they get to know you, they're great friends and
Yes.
they're great people. We've never had any major problems like that. Yes, every country has its share of gangs
Yes.
or share of hoodlums, but and sometimes you always have those corrupt government officials that
Well,
you have to
they-
deal with. They're everywhere.
I think a few have even landed in the U.S. I hate to say that, but a few may be floating around somewhere.
But
yes.
you always have to deal with that. But you find the vast majority of the people really do want an honest day's wage. They really do want to make a difference for their family, and they want to basically support their family
Yes.
and be there for the people that they truly do and love. They really love. So
Yes.
what we need to do is get down and understand their culture
Yes,
a little bit
yes.
better, and then try and figure out the things that they actually need. Some places need water, some
Yes.
places need medicine, some places need food, some places
Yes.
they need somebody to come in and help them, build a church or build
Yes,
a
yes,
school or something
yes.
like that. So those are the main things.
Do you try and train people, or in some ways, I guess, have an interchange? So you say, well, we're going to give you this, and maybe you can make use of it, and we'll be returning. And how can we help you? But
Yes.
use one of my favorite analogies: bounce the basketball. Can you let you try and bounce the basketball? Here's the basketball, and we'll let you bounce it.
Yes, we do indeed do that. One of the things we have had opportunities to work with is local pastors.
Mm-hmm.
We've set up training programs for many of them, their wives, and for others who would be interested in various sorts of things, financial management,
Yes.
marital counseling, and other sorts of things. But also, the Rice Foundation has got a school that they have built down there for pastors to teach them to be bivocational, because many
Yes.
of them need to work for a living. They need to be a carpenter or,
Yes,
or
yes.
a plumber or something like this, in addition to doing that. And then we can help use those skills to bring in water projects to put in a new well,
Yes.
or to help with build something that needs to be built, some building in a town, a city hall, a school, a church, or whatever. And by doing that, then those people, once we've trained them, can train others. And then it's a multiplicative effect.
Yes, that's a good
there's the
word, yes.
And as you start seeing more and more people being able to gain those skills. And by doing that, you may be able to teach them and help lift them up. What's the old saying? If we give a man a fish, I feed him for a day. If I teach him to fish, I
Yes,
can
yes,
feed him
yes.
for a lifetime. And some of that is what we have to do. Now, sometimes we, of course, want to bring in some medical supplies, take
Yes,
care of
yes,
some
yes.
problems that need to be fixed, because they just can't, they don't have a surgeon in the area, so we want
Yes,
to fix
yes.
their hernias and fix their other problems. And that's the type of thing you can come in, take care of them, and then leave, but you want to leave the supplies with the local doctors. And if you can go in frequently enough over a period of time and have enough teams go in, then they know that you're going to be there to back them up.
Yes.
And that you can help train them and get to know them better.
So is there some kind of, just outlining this strategy, is there some kind of overarching way people are thinking, well, we don't want to just shotgun this, but we want to pay attention to this one part of the country over an extended period of time and be there for them? And
Yes. In short-term mission work, one of the problems that we've identified many years ago was you could just go to a place and you're there for a week. And
Yes.
you fix the hernias, and you treat the medicines. 6 months from now, those people are going to forget you were
Yes,
there. The
yes.
medicines will have run out, the hernia got fixed, and
Yes,
they're on
yes.
doing something else.
Yes.
But on the other hand, if you can go in and find an area that you've identified and you want to stay there and
Yes.
build up some infrastructure,
Yes.
train some people to do some things, and then bring in the medical teams based upon what the need is. And you can
Yes.
actually be there enough to look and see what is the need. Do they need, do they need more general surgeons? Do they need somebody to come in and train them on a prenatal care
Yes,
program,
yes, yes.
nutrition programs, or whatever? Those are the sorts of things that once we are there long enough, you can identify those needs better and then start bringing in people. The intention of the Rice Foundation was to come into the Copan area because they noticed a terribly high maternal infant mortality
Yes.
rate back, 8-10 years ago. So the first thing they did was build a maternal clinic with an operating room on the back of it. Now they've built this pastoral school. They've got a dormitory there. They can hold meetings there and train people to do that. They've got a mission guest house there that we can go in. So those sorts of things are there. Now they're working out in the communities, bringing in water projects and other things.
Okay, well, that's, unfortunately, I'm going to have to say I do here just because we've run out of time.
Right.
But you have not run out of time, and keep up the good work, and that's just a great story you've told us tonight, Steve,
thank
and
you.
hope to
I
talk to
appreciate
you
it.
some more. Thank you.
Thank you.
Thank you.
Appreciate it.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.